Welcome all OET aspirants to our new video. We are speaking Aiders. Thank you for all the support, we do appreciate that. Please continue to watch, support and subscribe our channel. Kindly subscribe, and click the bell icon, for more updates and videos. Please share with your friends. Our aim is to make speaking tasks more friendly, and simplify them, with providing lots of ideas, and you can develop them into beautiful structures. Today, we're going to discuss one of the latest exam topics, leg swelling. A 63-year-old male patient visiting community health center with concerns over his swollen legs. Let's look at the task. Setting is community health center. You see a 63-year-old male patient who is visiting community health center with concerns over his swollen legs. Your responsibility as a nurse is to collect information about the condition and provide suggestions. Now, let's look at the task. Find out the reason for visit. Collect info, how and when it started, his profession, remedies tried, and any additional symptoms. Explain the possible causes in detail and find out the relevance of it. Provide management options, importance of hydration, and diet modifications. Advice on self-management and need of GP consultation. Let's begin the roleplay.
Good morning. My name is Damien, and I am the registered nurse working in this community health center today. Please come in and have a seat.
Thank you.
How can I address you?
You can call me Wilson.
How can I assist you today, Mr. Wilson?
Nurse, I have noticed that both my feet and ankles become swollen for a few days now. I would like to get some advice for it. It's really making me anxious.
I completely understand your concern, Mr. Wilson. There is nothing to be alarmed about. Please set your mind at ease. We can definitely help you, and will provide appropriate suggestions for you. In order to get a better understanding, I would like to ask you some questions regarding your swollen feet and ankles. May I?
Sure, nurse.
Since how long you have this problem?
Nurse, it started a couple of weeks ago.
Did you notice any specific timings for this swelling?
Yes, the swelling starts when I am standing at work and gets worse as the day goes on. But what's interesting is it goes down at night and has completely gone in the morning.
Did you try any remedies?
No, nurse, I didn't try any treatment options, as I thought it's just normal. However, day by day, it's getting worse, and that's the reason I came today.
Mr. Wilson, what kind of job you are doing?
I am retired as a school teacher and currently working in a firm as a security officer for the past 3 years.
How is your work pattern? For example, is it more kind of a standing?
Yes, nurse, it's a completely standing job for almost 8 to 10 hours per day.
Do you have any other symptoms other than swelling?
No, I don't have.
Thank you, Wilson, for providing me the details. I really appreciate that. Based on the information collected, and from my own personal experience of handling this type of cases, I suspect the likely cause of your condition may be due to fluid retention. It may be due to prolonged standing, and I assure you, it's a mild condition and treatable.
To be frank, I really don't understand why the swelling has started happening, as I have always stood for long periods of time in my both jobs. I believe there must be something else that is causing the fluid retention.
Okay, Mr. Wilson, I understand your perspective. Now, I will explain you the common causes of it. Can I?
Sure, please.
There are multiple reasons for it. The primary cause can be the use of diet high in sodium or salt. Secondly, inadequate hydration. In addition, in some cases, it may be due to medications or health conditions such as kidney, liver, or heart problems. Do you think any of these is relevant in your case?
Nurse, you know what? Some of the points you explained to me are very relevant in my situation. I do use a lot of salt when I cook, but I don't take any medication or have any health conditions. At the same time, I think I drink enough, as I have lots of cups of coffee during the day.
Thank you, Wilson, for the details. I clearly understand your issues.
Nurse, is anything I can do to relieve the swelling?
Of course, we have options, Mr. Wilson. Now, I will provide suggestions. Is that okay with you?
Perfect.
In order to relieve the symptoms, I recommend you to have proper and effective hydration. For that purpose, you can drink plenty of water and avoid taking coffees. Instead of coffee, you can have non-caffeine drinks like simple juices and green tea, etc. Along with that, I strongly recommend you to restrict or reduce the use of salt or sodium. Additionally, I suggest you to have potassium-rich diet like bananas, avocados, and so on to reduce the swelling. Will you be able to do this?
Definitely, nurse.
Apart from this, I advise you to consult with your GP to identify or rule out any underlying health issues.
Sure, nurse, I will.
Before we finish, I will explain you some of the self-care strategies you can follow to decrease the swelling. Firstly, exercise. It can play a vital role in your recovery. Secondly, elevation of legs above the heart level whenever you rest for a prolonged time. And lastly, the use of compression stockings for proper blood supply. I believe you will be able to do these measures.
Indeed, nurse, I will follow these strategies you suggested.
Being said that, do you have any more concerns?
No, nurse, you clarified all my doubts.
In that case, it was nice meeting you, and I wish you a speedy recovery.
Thank you, nurse. Thank you guys for watching this video. We hope you guys learned how to do a beautiful roleplay discussion. Please continue to watch and support our contents. Press the like and subscribe button to show your support. See you with our next video. Meanwhile, if you have any doubts or suggestions for any roleplay, please comment. Bye, we are Speaking Eaters.